However, I watch with concern the latest VDS measures. With effect from 15th January, the unvaccinated will not be allowed to go back to their workplace even if they tested negative. I'm particularly disturbed by this latest measure that puts the livelihoods of the unvaccinated at risk. What is the justification for preventing the unvaccinated from returning to their workplace? It is not for fear of infecting others because vaccination does not stop the transmission of COVID-19. The risk is therefore mainly to themselves, not others. They bear the brunt of their decision not to vaccinate. I understand that the government is concerned about the health of the 52,000 unvaccinated employees. But I also believe that these 52,000 people are at least as concerned about their own health and safety as the government is, if not more so. They must have strong reasons based on their own individual circumstances and personal medical history for sticking to their decision not to vaccinate. It is always a good idea to keep an open mind. Treat current knowledge with caution and not be too absolute in our measures because new knowledge could emerge later to prove us wrong. A good example would be the government's stand on masks in the initial stage of the pandemic. We urge the government to rescind the ban on the unvaccinated returning to their workplace from 15th Jan and continue with the current arrangement of using testing as the means to control the spread of COVID-19.
Our experience over the past few months shows that VDS will enable us to continue our path of safe and calibrated reopening, whilst at the same time minimizing the risk of hospitalization to preserve healthcare capacity. In particular, limited hospital and intensive care unit ICU resources. It is important to note that non-fully vaccinated persons who are infected with COVID-19 are more than 7 times more likely to become critically ill in ICU compared to those who are fully vaccinated. So although a small proportion of our population, they take up a disproportionate amount of medical and hospital resources and contribute to significant amount of workload of our hospital staff. These are not mere statistics. It is actual resources being drained because of people who fall ill because of COVID-19. The basis for VDS is therefore twofold. First, by putting restrictions on their social activities, we protect the unvaccinated by preventing them from being overly exposed to the virus. And the member earlier said, well, it is just for them, right? But that's not true because the second point is that if fewer unvaccinated people get infected, we preserve our hospital capacity while allowing the rest to carry on normal activities as much as possible. As of 2nd January 2022, there were about 48,000 employees who had not taken any vaccine dose. This is a reduction from the 52,000 reported on the 19th December 2021. We still allow employees who are certified medically ineligible for vaccines under the National Vaccination Programme (NVP) to return to the workplace, given that they constitute only 0.3%, a very small proportion of unvaccinated workers.
In implementing this strong measure, which risks 48,000 livelihoods, MOH must have done its studies on what is the impact, basically, specifically on the number of expected job loss versus the additional burden on the hospital ICU utilization.
Even if you're looking at the 48,000 of the workers that are now currently unvaccinated, and just talking about 1% of them, that's already a high number and that's already going to tax our ICU bed capacity. So that's one. We are actually just looking at how, even with that small number, is going to impact and tap on scarce resources which could very well be deployed for other needs within the community.
I think it's quite hypothetical using the 1% of the 48,000.
I'm afraid the 30 minutes allocated for the adjournment motion has lapsed. Order. The question is that Parliament do now adjourn. As many as are of that opinion say aye. Aye. To the contrary say no. I think the ayes have it. The ayes have it. Order. Order.